Hey guys, good morning. Hey, today we'll be talking about a topic which I've been broached for the last few months, and that's my favorite topic. Basically, 1/3 of what I do is scarring or acne scarring. So today is a laser-free day. We're talking about subcision or surgical subcision for acne scars and how I do things. Okay, so basically, subcision, what does it mean? Basically, it's breaking down the bonds which hold down the acne scar. Once we free up these bonds, basically the scar can lift a little, and as a result we can use other modalities, other treatments such as lasers, fillers, microneedling, PRP, TCA cross, and actually raise or improve the scars even further. Okay guys, look, for a quick explanation of what tethered scars are, first of all, no smart aleck comments. Yes, my daughter can draw better than this and she's only 3, but I'm doing it with a broken finger, so please give me some grace. Tethered scarrings are basically scars which are pulled down and they're attached to your muscle layer. That's why when you actually smile or stretch your skin, they actually pucker down. So the whole idea of subcision is a horizontal method to break down these scars. And what we're doing is we're actually going down here using various needles and various energy devices to actually break these scars down so that over time they become less tethered. So basically you're freeing them up from the underlying muscle. No amount of laser treatment can actually free up that scar because the lasers go vertically. Microneedling goes vertically, but to some extent, if you go really deep, let's say using 3.5 mils, you may actually break it up using microneedling, but lasers, they don't go down that far. So unfortunately, lasers don't work, chemical peels don't work, it's just too far. And you do need to actually break this layer because that is attached to your underlying muscle. So that's the whole concept of subcision and the various methods, which I will show you shortly, and how I do things. Thanks for that.
Okay, so the first step is to actually know your scar type. There are various different scar types, and the best thing to do is actually look under angle lighting to see the different types of scars you have. Looking, seeing, and the angle lighting together with touch is extremely important. You can see when I stretch this, it shows that this patient has a lot of atrophic scars, but she also has some tethered scarring. So touch is extremely important because it gives us an idea of what kind of scars you have. You can see she's lacking a lot in volume, and hence volume replacement together with subcision would be the treatment of choice over laser for her. I also get patients to animate, in other words, move their muscles, smile, and basically what this gives me an idea of is whether the scar is attached to the underlying muscle and the underlying skin. So I get them to move in all directions, and it gives me a really good idea whether they are a good candidate for subcision. So once again, animation, in other words, smiling and muscle movement is extremely important in the assessment of acne scarring. So I take a lot of time to actually map these scars out, and you can see once we get this map done, we can actually photograph it, and we know if the scars pull down when they're stretched, chances are they are tethered or anchored, and this is where subcision is indicated. So we're stretching the skin gently, and you can see the scars actually pucker down. So we know that releasing the scars will actually help the patient. So what other methods, or what subcision methods do I like using? First of all, straightforward needles. So in this technique, I'm using what's known as a wiper technique. So I'm using a 21 gauge needle. I'm basically entering the same hole and going through it 3 times, and basically using a windscreen wiper technique to break up the bonds. So you can see as I'm sweeping across, the bonds break, and as a result the scar lifts up a little, and this frees up the scars from the underlying muscles. Now my favorite technique is a no-core technique.
Look, this is my favorite subcision instrument. It's called a no-car needle, a no-core needle, together with a syringe. This syringe can be pre-filled with PRP or can be filled with filler. So come in close and I'll show you why it's so good. Come on through. Don't ask me why I'm using gloves with fruit, but I guess it's just the principle of it all. But anyway, here we go. This is a no-core needle. No-core needle can actually go through the skin, and it's so accurate you can actually place it. See the tip over here? So the tip actually cuts the scar. So you can see I'm actually cutting the apple with this, but it's a very precise instrument.
So I can actually guide it to where the scar is, feel where the scar is, and then actually cut the scar whilst it's underneath. So you can imagine this as the skin, and you can imagine me just positioning myself where I want this needle to be and then releasing it this way. The great thing about it as well is I can preload this with whatever I want in the needle. In this case, if I'm using a bit of filler, you can see if I actually cut the scar, I can actually inject a bit of filler and the filler can go in there. So I can get 100% correction whilst I'm doing this procedure. So it's a super cool instrument. And this is the instrument of my choice for most cases of subcision. So it's called a no-car or no-core needle, and it's super cool.
So the first step I do is actually mark the area which I want to subcise. So you can see there's little dots up there. I also use some local anesthetic prior to this procedure. And you can see me going in with a no-core needle. I'm freeing up the bond, so I'm seeing where the area of resistance is. And then I'm just giving a tiny little sweep across, and that basically just frees up the bonds. You can see that instantly lifting up the scar. So I'm basically cutting from underneath. As this is purely tethered scarring, I did not use any filler nor PRP, and the bonds raised up nicely with just this no-core technique. So very good technique for some scars. This is using the same needle in the subcision, however, I'm using this on individual scars. I pre-mark these areas prior to subcision because when I inject those with local, I kind of lose where the scars are. So pre-marking and pre-planning is extremely important. And this is a very gentle process, not much bruising. And with each treatment, we get approximately a 25% improvement. In other words, the scars raised by 25% with each subsequent treatment. Another treatment which I like is using something called PRP with subcision. So I use the Infini, which is basically a microneedling device that goes vertical. I use PRP over, in other words, platelet-rich plasma. I place that over the microneedling holes. But then I also go under. So if there are tethered scarring, I basically use this needle, a long needle, and I subcise underneath the actual scars itself, the tethered scars, and at the same time inject PRP. So the PRP acts both as a spacer and also as a growth factor to actually accelerate or improve healing times. So this is called my PRP subcision technique. Now, the last method I'll discuss is a new device. It's called Iono Plus RF Subcision. I've used this once, and I've used this once only overseas. I don't quite like using this. I'll tell you why. It's because I feel like it may be a little bit too aggressive with the subcision. Yes, we are using an insulated RF needle. However, if you see the techniques which the Koreans teach, of aggressive subcision, I do believe that this may lead to too many, I guess, too high of a chances of bleeding and hematoma. So I stay away from this technique. However, I'm sure there are a lot of guys out there who can perform this very, very well, but not my favorite. So let's have a look at a couple of before and afters. So this is before I use subcision and filler. This is immediately after the treatment. And this is actually 2 weeks after 2 treatments. So we've got a pretty good result just by using subcision filler. This is purely subcision, no filler was used. In this indication, I was treating both acne scarring as well as surgical scarring. So what other subcision and filler techniques do I use? Well, let's have a look. And I'm injecting a good amount of volume to actually lift the scars from underneath. Excellent technique for supporting scars. Subcision filling technique, once again on the contralateral side, in other words on the other side. So I am subcising. You can see me, I'm subcising and filling at the same time. So as soon as I feel that there is tethering, I'm actually breaking down the bonds. So this is another method which I use. It's called a tunneling subcision technique. So you can see me, I'm actually trying to feel, saying, hey, what's going on? Is there something holding down this, this scar? If there is, I subcise. I also tunnel. The reason why I tunnel, in other words, I go back and forth in all different directions, is to spread the filler evenly across the area. If I don't do that, then you have a big blob of filler. So you can see I'm tunneling, going back and forth before I even inject, and then I inject slowly, and then the filler actually dissipates in that area. So it's very important. And I go back and forth again to make sure there's no tethering. This is pure subcision, so you'll see later the before and after results for this. So I'm trying to figure out where is it in that scar that has the tethering. So I'm going back and forth, and when I can find that pucker, it's done.
So there you have it, guys. That's dermal filling for you. It's my way of actually using dermal fillers to treat certain types of acne scars. Remember, please remember this. It is not the only way to treat scars. There are to actually treat acne scars to a good level, you need to actually know how to fill, you need to actually know how to subcise, you need to have surgical expertise, you need to use chemical peels such as TCA cross. You've got to muck around with all of these or know all of these lasers, microneedling system, PRP, the whole lot. And that's when you get the best results from scar revision. So it's not just one technique, it's not just one laser, it's just the skills to actually do the whole lot. Hey, I had this guy who came to see me from all the way from Portugal, and he took a flight just to actually come for a visit to Australia, and I helped him over a period of 1 week. I can't help everyone, but lucky for this gentleman, he had the type of acne scars, which are basically the rolling atrophic together with scars around his temples, which did extremely well with just 2 sessions of fillers together with Subcision. So listen to his testimonial. Once again, it's not a paid thing. It's not a advertorial. It's just his experience with what he's had with what I do. Mario, how's everything?
Yeah, great. It's
good.
Perfect results here. It's perfect.
Very good. So look, I've skeptics out there on the internet to say, hey, look, when we take a photo, when I take photos and look at the photos through lighting, it's not standardized lighting, and I say it's very, very hard to do standardized lighting because you saw me before, I use light at all different angles.
Yeah.
Now, I always say the biggest critic is the patient. In other words, it's you, right?
Yeah, it's perfect. It's perfect, man. The atrophic scars are gone.
Yeah.
It's incredible.
Okay, so we can see on close examination, he had atrophic scars on the temple area. I wouldn't say gone, they've markedly improved, probably about 90-odd%. He had a really atrophic scar, which was also tethered down on his forehead. And I subcised that. And how do you feel about that one?
Yeah, this one is great. I mean, it was my biggest scar, and now it's gone, man. It's gone.
Okay.
Yeah.
That bruising there will subside. The reason why I gave bruising is because I went underneath and I subcised it. So that's totally gone.
Yeah.
The ones on his right temple, I would say, once again, I don't like to say that they're totally gone. I like to say they're probably 90% improved. The ones on his cheek, which we could see with angle lighting beforehand, I would say it's probably about 90-95% improved.
Yeah.
So look, guys, I can't do this to everyone, but for Mario, who comes to see me with these kinds of scars, yes, 2 treatments and they're done.
Gone. Yeah, 1 week.
In 1 week.
Yeah.
Okay,
Great,
Mario,
man.
thank you very much.
Thank you very much.
So these are further examples of my filling technique. This is atrophic scarring together with tethered scarring. I used obviously some HA fillers, and this is about 2 treatment sessions, 2 to 3 treatment sessions. This lady had lupus, so I couldn't use any lasers. So in the end, I used HA fillers, and this is after probably about 3 treatment sessions. Really marked atrophic rolling tethered scars before and after. Not a perfect result, but look, markedly improved. No lasers were used in this case. So this lady has a lot of anchored together with tethered scars as well as atrophic scarring. So I used my method of subcision together with filler, and this is after 3 treatments, approximately 3 months in total apart. So this is the end result.
So guys, there you have it. That's acne scar revision using Subcision. So once again, I didn't mention one bit of laser because you can see with those tethered scars that are pulling down on your skin when you smile or when you animate, the only reasonable thing to do is to actually break down those bonds from underneath, and that's why surgical subcision works so well. Most patients require about 2 to 3 treatments over a period of 2 to 3 months, and we are going to get some improvement with each treatment. So remember, it's always the method. You always try to find what type of scars you have and match it to the method to give you the best results. So remember, there are lots of other scar types, including ice pick scars, box scar scarring, rolling scars, atrophic scars, heaps of other scar types, and that's why you need multiple modalities.
So that concludes subcision and filling techniques. What other treatments do I use to treat acne scars?
Guys, here's a teaser on what I do. It's called Infini or energy device microneedling. I like to use an energy device, but actually an insulated needling system. So that produces about 20,000 microchannels. Then I actually use PRP or platelet-rich plasma in an over and under technique. So over means it's actually over the top of the skin, and these actually get spread into the microchannels. If they're atrophic scars, are actually injected under the skin. Then these droplets actually get spread onto the skin surface. I then developed something called a PRP mask. So you can see me, this mask is actually infused with the patient's own platelet-rich plasma. The mask then gets placed on the patient's face, and then I infuse it again with what's remaining of the PRP solution. So imagine that you've got 20,000 channels on your face, you've got your own stem cells, growth factors, and really good stuff. And then we actually use a stocking, and we actually put that on top of the face and to hold things in place for the next 30 minutes. Healing up time is within realistically 2 to 3 days, and I tell the patients don't walk into a bank within the next 1 hour. So the laser itself is very, very noisy. That's the erbium laser. The CO2 is much quieter. You can see me doing some passes over here. Typically I use a 100 to 200 micron pass. In other words, 100 micron is your entire surface of your skin off. So if I do that 4 times, it's basically 4 times the thickness of your skin. So what's the level? What level do I actually stop at? Well, the answer is that I chase the scars. So if someone has, let's say for example, this gentleman has a darker skin type, I don't chase it so deep, and hence that's why I use procedures such as TCA cross to actually raise the scars first. While if someone has lighter skin type, like a Caucasian skin type, I can chase the scars a lot deeper.
So what are the before and afters like following fully ablative lasers?
Laser resurfacing, you can see she's got an immense amount of scars, but they lie in the same plane. And for her with type 1 skin, we can use a fully ablative laser, and this is after 1 treatment of erbium together with fractional CO2. That's just 1 treatment 3 months later. The second treatment is once again box scar scarring in someone who's got type 1 skin, before and after. So this is after just 1 treatment. She's got a bit of dyspigmentation or skin color changes, but that will settle in time. And let's look at another example. This is an Asian lady with box scar scarring in the same plane. So once again, erbium laser, 1 treatment only, and this is what the results are like 3 months later. Not perfect, but you know, realistically 90% there. This lady on the other hand has rolling atrophic scars, but she also has box scar scarring. She's a skin type 1, in other words fair skin type, and instead of going through 4 or 5 different fractional laser treatments, I decided to treat her with 1 fully ablative erbium laser coupled with fractional laser in the same procedure. So here she is. I mean, it's a huge improvement 3 months down the track. You can still see a couple of atrophic scars, really small scars. Okay guys, now so this is the most overhyped method of treating acne scars, and that's called fractional laser resurfacing. They all work by the same mechanism of treating portions of skin so that the untreated portions heal up faster. Here I'm using a Fraxel 1550. This laser is an okay laser. Look, I don't rate it highly for the treatment of acne scars because there are much better lasers than this for specific treatments of acne scars. But it gives an overall improvement. It's like a Swiss Army knife. It's a jack of all trades. It does work, but I prefer other lasers. So what other Fraxel lasers do we have? We have this. This is a much more powerful laser. It's called a Fraxel CO2 or Fraxel repair laser. This actually works a lot better for acne scars compared to the 1550 wavelength. The downside about this is the downtime. It takes about a week to recover.
This is called profractional, in other words, fractional erbium laser treatment. I used to use this a lot for darker skin types, but once again I find this outdated compared to the newer microneedling systems we have today. So I hardly use it. So what are the latest in fractional lasers?
Okay guys, so we're talking about different kind of laser. I do believe that the future of laser resurfacing is called hybrid laser resurfacing, in other words using two different wavelengths. Today we're using the U laser. I don't know much about this laser because it is the first time I'm using it today. We're combining two wavelengths, a non-ablative wavelength together with a traditional CO2 wavelength in the same patient delivered sequentially. So the application for this in this setting will be acne scarring, and we'll see how it's done shortly.
And then my press.
Count of 3, 1, 2, 3. How's the pain? Out of 10? 3? 3.
So this is using a hybrid laser. Like I said, we're using a CO2 laser together with a 1540 delivered in a special manner where we maximize the actual efficacy of this laser but minimize the downtime. So like I said, the results I really can't comment on until I actually see them myself.
So what are the before and afters like? I'm just showing you a few of the before and afters. There's a lot more on my website, but here we have type 1, type 2 skin with large open pores, acne scarring. I used 1927 Fraxel, only one treatment before and after. So that's 1927 Fraxel fractionated laser. This is a CO2 fractional laser, and that's after 4 treatments, in 4 treatments only with CO2 fractional. And once again, this is CO2 fractional using the core. So that's after 4 treatments of fractional laser spaced about 6 weeks apart. Another one of my favorite methods is to use chemical peels called TCA Cross for acne scars. I like to use 100% strength TCA Cross. Traditionally, it's been delivered by using a toothpick, but what I've done over the past 7 to 8 years is reinvent my own method, and I use what's known as a syringe delivery. So you can see me over here using a syringe, but I don't inject it. I actually use these as droplets, so you can see me gently dropping these droplets of TCA into each scar. So it's not injecting, it's just dropping into each of the deep layers of the skin. So I'm finding the deepest acne scar, and I'm treating from the deepest to the shallowest. So this takes about 15-20 minutes to do, depending on the number of scars. And the white bits you see will fade in about 3 hours or so. So we're speeding this up about 4 times, and you can see how quickly I work with the droplet system, so I don't have to re-dip every time with the toothpick. So this is my method of doing TCA Cross, and I'm using 100% TCA in this situation. Pain is not an issue as it feels like ant bites. So what are the before and afters like? So if we study the first case, you can see that this person has a lot of deep ice pick scars, really deep scars, and is an ideal candidate. The skin heals up in 5 to 6 days, and after one treatment, look at the afters. We've really filled up those really deep scars with TCA. Okay. The second patient also has deep scars on the chin area, ideal candidate. After 2 treatments, this is what he looks like. The scars have been filled up, so ideal candidates. In this case, I performed 2 TCA Cross plus surgery, and the after results once again are pretty good. Let's discuss the most basic of all procedures, skin needling and dermapen.
I much prefer the use of a stamping procedure on the right compared to a rolling procedure on the left. The reason being it causes a lot less trauma to the upper layers of the skin or the epidermis. What does this mean? It means that the effects are better, but most importantly, the healing times are much better. So you can see what the stamping procedure does compared to a rolling. There's less ripping of the skin. So when we're talking about skin rolling as a first step, this is my method of how I perform the procedure. Once again, this is an entry-level procedure.
1, 2, 3,
4, firm pressure there, and we're going back up here again, up just this way. 1, 2, 3, 4. How's the pain?
I don't feel anything.
Great, because he's got local anesthetic. And here we're going 4 again. 1, 2, 3, 4. You can see the pinpoint areas of bleeding. 1, 2, 3, 4.
So this is a quick explanation of radiofrequency.
This is not needling, but it's called sublative. It's E-matrix made by Syneron Candela. It uses pins, like you can see here, 64 pins in the head. And basically what it does is that it rests on the skin. It doesn't penetrate the skin. And you can see the treatment itself here. You can hear the clicking noise from this, which means there's an energy pulse which has been delivered. Once again, this is radiofrequency, much like Infinity, but it does not penetrate the skin. I prefer this for early acne scars like this, so treating both acne and acne scarring together, before and after. So you can see a marked improvement in both acne and acne scarring. So I like it for the prevention of acne scars and the treatment of early acne scars, early atrophic acne scarring. In this case, I did not use a laser, I used E-matrix, which is radiofrequency, and he only needed 4 treatments for substantial improvement.
So how do I approach the treatment of red acne scars? Red scars are one of the easiest to treat and most predictable scars to treat. So treatments are usually spaced about 3 to 4 weeks apart, and you usually need about 3 to 4 treatments. And once again, they are the easiest scars to treat. So it's not a long video. It just shows you that treatments are possible. I like using the V-beam laser because of the inbuilt cooling system. So basically treatments are painless and it just works. Remember to use sunscreen after your treatment, and that accelerates healing as well as results.
Surgical methods are extremely important to grasp when it comes to treating acne scars. Certain scar types need to be excised. And here you can see me suturing an incision from a acne scar. And what I normally do is that 3 to 4 weeks later, I resurface over this and the scar line will be invisible.
Thanks again for watching this really long video and for your attention. Look, just to put it out there, I'm not the only guy doing it. I'm not the best guy in the world doing it. If you go to my website, which is below, lasersandlives.com.au, and if you look at the out-of-town patients, I basically list all the doctors I know. It doesn't mean that there are no other doctors that are out there that do the procedures I do, but all the other doctors I know throughout the world who perform acne scar procedures or revision very similar to what I do, if not even a better standard. So guys like Jason Emer in the United States, Philip Young as well, Steve Weiner, all of these are colleagues and friends of mine who I know do a really good job. In Asia, if you live in Asia, Professor C.L. Goh is my mentor, and he does an excellent job in regards to scar revision, especially in ethnic skin types. I'll probably say I learned more from him from treating ethnic skin types than anyone else. So remember guys, I'm not the only one in the world. Please, you can email these guys, or better still, you've got to actually see them, because when we assess acne scars, you can see it's always about look, but it's also about touch, animation, and also feel. We actually feel to see how tethered your scars are. This gives us the best way of giving you a treatment plan. It's not just static photos, because that's very inaccurate. So thanks once again for watching. Subscribe if you like this channel, and I'll post more and more on acne scar revision and what's new in the upcoming weeks and months.
The website is constantly updated with the latest and greatest on all acne treatments as they arise. Look, if you're keen on learning more about acne scarring, please subscribe to my channel. I also post a few clips and videos on Instagram every week. Once again, thank you very much for watching, and I'll see you next Saturday. Bye.